Knee replacement surgery in Delhi. The knee joint is crucial for mobility, but factors like age, arthritis, and injuries can cause chronic pain and limited movement. Knee replacement surgery is a solution worth exploring. Procedure. Let's break down the knee replacement procedure into 3 key phases. Firstly, damaged cartilage and bone are carefully removed from the knee joint. Then, a durable prosthetic knee joint, typically made of metal and plastic components, is implanted. Finally, the incision is closed, marking the completion of the surgery. With advancements in medical technology, minimally invasive techniques are often employed, leading to smaller incisions and faster recoveries. Recovery timeline. After the surgery, recovery duration varies based on individual factors. Patients typically spend a short period in the hospital for observation and initial rehabilitation. Physical therapy plays a vital role during recovery. Customized exercises aid in restoring strength, flexibility, and overall knee function. Though assistive devices like crutches may be needed initially, most patients gradually regain the ability to walk without support. Benefits. Let's now explore the numerous advantages of knee replacement surgery. Pain alleviation. The most noteworthy benefit is the relief from chronic knee pain. Surgery can significantly reduce or eliminate pain that once impeded daily activities. Enhanced mobility. With a new knee joint, mobility is vastly improved, enabling you to engage in activities that were previously challenging. Durability. Modern prosthetic knees are designed to last for years, facilitating an active and fulfilling life. Thank you for joining us. Remember, a healthy knee is your pathway to a happier, more active life.